The following are the borders of the upper limb. The anterior border is the deltopectoral groove. The posterior border is the posterior deltoid groove. The upper limb consists of numerous regions: the deltoid region, the axillary region, the anterior region of the arm, the posterior region of the arm, the anterior region of the elbow, the posterior region of the elbow, the anterior region of the forearm, the posterior region of the forearm, the anterior region of the wrist, the posterior region of the wrist, the palmar region of the hand, and the dorsal region of the hand.
Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description.
Within these areas, the muscles of the upper limb are located. These include the muscles of the pectoral girdle and the muscles of the free part of the upper limb. The muscles of the free part of the upper limb are divided into arm muscles, forearm muscles, and hand muscles. There are two groups of arm muscles, anterior and posterior. They are separated by the so-called medial and lateral intermuscular septa. The anterior group consists of the flexor muscles. These include the biceps brachii muscle, the coracobrachialis muscle, the brachialis muscle. The posterior group consists of the extensor muscles. These include the triceps brachii muscle and the anconeus muscle. Let's examine each muscle in greater detail. The biceps brachii muscle. Origin. The long head arises from the supraglenoid tubercle of the scapula, and the short head arises from the coracoid process of the scapula. The muscle inserts into the radial tuberosity with a single tendon. The bicipital aponeurosis arises from the tendon. Function: flexion of the upper limb at the elbow joint and partially at the shoulder joint. The following structures innervate the muscle and supply it with blood. The coracobrachialis muscle. It originates from the coracoid process of the scapula and inserts into the anterior and medial surface of the humerus inferiorly to the crest of the lesser tubercle. Function: flexion and adduction of the upper limb at the shoulder joint. The following structures innervate the muscle and supply it with blood. The brachialis muscle. It originates from the inferior 2/3 of the humerus distal to the deltoid tuberosity and medial and lateral intermuscular septa of the arm. Inserts into the tuberosity of the ulna and the capsule of the elbow joint. Function: flexion of the upper limb at the elbow joint. The following structures innervate the muscle and supply it with blood. The triceps brachii muscle. Origin. The long head arises from the infraglenoid tubercle of the scapula. The medial head arises from the posterior surface of the humerus medial to the radial groove, as well as from the medial and lateral intermuscular septa of the arm. The lateral head arises from the postero-external surface of the humerus, as well as from the lateral intermuscular septum. The muscle inserts into the olecranon of the ulna by a common tendon and into the capsule of the elbow joint. Function: extension of the upper limb at the elbow joint. The long head also performs extension and adduction at the shoulder joint. The following structures innervate the muscle and supply it with blood. The anconeus muscle originates from the lateral epicondyle of the humerus and the radial collateral ligament. Inserts into the olecranon of the ulna and the capsule of the elbow joint. Function: extension of the upper limb at the elbow joint. The following structures innervate the muscle and supply it with blood.